My name is Emma Scott. I'm a physician assistant here at Parker Cornea, and today I'm going to be walking you through a typical day in the life of an ophthalmology PA in surgery. So here I am walking into the OR first thing in the morning, saying hello to everyone, and then I will count the Valium. We always like to just make sure our count is correct from the week prior. And next, I'm grabbing a sticker to mark the first patient. So I'm going into the first pre-op room. We always put a sticker above the eye we're doing surgery on just to make sure, and then I'll go through the patient's chart with them. So I kind of do a little mini history and physical. I go through their medication list with them, their medical history, surgical history, drug allergies, things like that, just to make sure we have everything correct in our system and make sure they're not on any medication that would interact with Valium. Once I've marked the patients, the first couple patients in pre-op, I'll head into the first OR to get things started. So here I am just putting on my mask and I'm scrubbing in. I usually will help the scrub techs kind of organize the table and get everything ready because a lot of the time the first few cases just have a lot of setup, so I will help them a little bit. And then I move my attention to preparing the tissue for surgery. So this first case that we were doing was a DMEC surgery, and the tissue comes in this little glass tube, which I am going to connect to a syringe, and I'm pushing out as much of the preservatives that it comes in into the glass bowl. And once I feel like it's ready, I put it onto the scrub tech's tray and we kind of place it vertically. We find that the graft seems to do best that way. Another thing I'll often do is help the scrub techs with draping. So we put a plastic drape over them, make a little opening with some drape scissors, and then place a speculum in their eye. That's what you just saw me putting in there. And it just holds their eye open for the duration of the case, making it a lot easier. The next thing I do typically is perform a block, a subtenons block. So I pinch up some of the conj and kind of dissect under the tenons capsule with some Westcott scissors. And then I'm using a flexible angiocatheter on a syringe to inject, whether it's bupivacaine or Exparel, whatever block we're using. In pre-op just now, you saw me preparing for CARES surgery, so we'll get a Pinicam the morning of surgery, and I plan on where the CARES segment's gonna go, the depth at which we're going to, or the doctor's going to put the CARES segment. Here I am preparing some CARES tissue for a surgery. So it comes in this little jar and then I pull it out and try to dry it out as best I can because it's much easier to insert the CARES tissue when it's dry versus when it's wet. So I kind of try to dry it out as best I can and then I place it on this little CARES drying device, which is super helpful because it'll hold the CARES segment in place. So it'll dry in that shape that we want it to be in. Here's me draping another patient. I do this a good amount on surgery days. And this is just to keep everything clean and hold the eye open for the doctor. And then here's me doing another block. Another thing I often do in the OR is mark the eye. So whether it's for a toric lens and marking the axis, or if it's for a CARES segment insertion. Here's me doing another block. So I'm just using some forceps to pinch up the conj. I think it'll show you a little close up here in a second of me dissecting down, kind of making myself a little pathway for the flexible angiocatheter to go under that tenons capsule. I try to always push it as close down to the hub as possible and then slowly inject the medication. We've found that this seems to be the most comfortable way to perform a subtenons block for the patient. Many of them say that they don't feel it at all, which is really wonderful. And then their eye feels a lot more comfortable during the case and for the days following. In some cases, I end up gowning and gloving in. It kind of just depends on how involved I am in the case. So this is most likely a CARES procedure. I do probably the most in CARES. So I gown and glove for these because I do make the opening incision for these surgeries. So the very first thing that I do for CARES is kind of dry the eye off with some Wex, and then I will use a crosshair instrument to mark the center of the cornea. Based on that, I'll mark where the opening incision is going to be. And then using a diamond blade, which is what you can see me dialing here, I will dial the blade to the correct depth based on their Pinicam images, their corneal thickness at the incision site. And then here I am making the opening incisions. The doctors are watching on the TV. And then as soon as I finish this part, one of them will sit down and start operating. And then, all they need to do is kind of make themselves a little channel for the segment, and then they can insert the segment and the surgery's pretty much over. So what's really nice about being a PA in ophthalmology is you get to help so much by just speeding up the doctors. Oftentimes I'm doing all of these things while the doctor's in the other operating room finishing up whatever case he happens to be on. So that's a pretty typical day for me as an ophthalmic PA in surgery. I get to speed up the providers because while they're in the previous OR, I'm getting things going in the next room. If you have any questions at all, please feel free to leave them in the comments. And thank you so much for watching.